Assalamualaikum and good morning. My name is Surah Akmal Safina binti Muhammad Nur Hisham, together with my partner Inta Khadijah Najwa binti Muhammad. Today we would like to present about our interesting topic, which is road crashes that happen in Malaysia and West Ethiopia.
First is introduction. A road crash is incident that may result in injury, death, and property damage involving at least one vehicle in motion on public road. Road traffic accidents have become a major public health problem, especially in developing countries like ours. Every year, thousands of people lost their life or suffer serious injuries due to road crash. This accident not only cause pain and loss to families but also affect the country's economy and health system. The effect of road crash can range from minor injuries to severe and permanent disabilities such as spinal cord and brain injuries. In many cases, they are one of the leading causes of death worldwide. The next slide. Okay, this is the credibility, which is we concerned about the growing number of road accident in my community, and we witnessed that an accident where the victim did not receive help in time. So we realized the importance of emergency response system in saving lives. Understanding the patterns of this accident is very important. It helps us improve road safety measures and reduce the number of future fatalities. The next slide.
Thank you, Intan, for the introduction and credibility. Now let's move on to our first chart, which is multi-line graph. The title for our chart here is Road Fatality Trend by the Type of Road User from 2012 to 2022. This graph shown here is taken from Department of Statistics Malaysia DOSM 2022. The purpose is to show the trend of road fatalities among different type of road user over time. As you can see on the horizontal x-axis here on the graph, we can see the years from 2012 to 2022. Meanwhile, the vertical y-axis show the number of fatalities ranging from 0 to 5,000. Each color like represent different group of road user, as you can see at the color code reference on the right middle here. For example, the blue line for motorcyclists, the light orange for car user, and P for pedestrian. From the graph, we can also see it clear that the blue line for motorcycle remain the highest throughout 10-year period. How crazy is that? The number of motorcycle deaths stay between 4,000 to 4,700, showing only slight fluctuation. The line for car user in the second highest with around 1,000 to 1,500 deaths each year. The pink color for pedestrians stay much lower below 600 deaths, while other categories such as lorry, bus user remain relatively stable and low. In the graph, we can also notice a sharp decline in all categories in 2020 and 2021. This is because mainly due to the COVID-19 lockdown when travel was limited. However, in 2020, the figures rose again as road traffic returned to normal. That's all from me. Next, intern.
So this is the chart 2, which is bar graph. The graph title is place of death among road traffic accident in West Ethiopia in 2019. The graph taken from African Journal of Emergency Medicine in 2021. So the purpose graph is to show the percentage of fatalities based on the place of death among road traffic accident victims. The S-axis, as we can see, place of death, which is the on scene, in road, emergency room, in ward or ICU, and lastly is on the way and in referred hospital. So as we can see, the highest of the percentage, which is the emergency room, which is 31.5%. This shows that many victims reached the hospital but couldn't survive during emergency treatment, possibly due to delays or limited medical support. Second is the lowest, which is the in ward, which 13% only, meaning those who survive longer receive better and more stable care. As we can see, the percentage of on scene and on the way in refer hospital slightly is the same, which is 20.4% and 90.4%. And this shows that many victims lost their if either immediately at the crash site or while being transported for further treatment. Next slide.
Okay, for the conclusion, we can conclude that continuous data monitoring is essential to develop the effectiveness of road safety policy.
So, the government and health organizations should focus on upgrading ambulance service, trauma care units, and road safety education to reduce the preventable deaths.
And this is our reference that were taken from article or website. Okay, that's all from us. Thank
Thank
you.
you.